Good morning, everyone. Thank you so much for joining us on today's webinar. So I'm hoping you're all set up and ready to go. And yeah, we'll dive right in it. And yes, today we'll start off with our objectives for the session. And so today we're really here to give you some of an overview and a bit of rationale behind Canada's strategy for patient-oriented research, and more specifically cover an entity that falls under that strategy by introducing you to the Child Right Network and go over its vision, structure, and scope of work. But to get us started, we figured it's a good idea to get a sense of everyone who is on the line today. So in the chat box in a moment, I'm just going to share a link with you all, if I can pull that up. So I'm going to just visit that link, and on any of the stakeholder groups we have listed here, just feel free to relay sort of your perspective, and we will get a sense of the number of participants we have today. And I will share the screen as the responses come in. All right, that's great. It seems like we have quite a nice mix of individuals who are involved here today, and it seems like we're principally researchers and trainees. That's really great. All right, yeah, that's great. It's wonderful that we have such a mix, and it's really great to see everyone's perspective. So the next prompt I have for you is just before we get started on this whole idea of delving into what patient-oriented research is, I'm going to make the link active again. And so the question we have here is that typically research has been in the domain of academics and researchers. In your opinion, what benefit do you think that the patient perspectives bring to the table? Just bear with me a moment as I switch over our question, and then you should be able to just go to the same page you had a moment ago and fill out the responses. And again, we will sort of get a sense of everyone's input in that regard. All right, so we're seeing some of the responses saying that patients have a unique viewpoint on account of perhaps their lived experience. Patient involvement in the research process will allow researchers to ask the right questions, so questions that are perhaps more relevant to patients, looking at priorities that are likely more in tune with their needs and where they are in terms of navigating their disorder. All right. Good quality research, that's a great example for involving patient involvement in the research process, because again, we have novel approaches and perhaps novel avenues to investigate that are relayed due to the unique perspectives that patients can bring. Building equity, I like that. That's wonderful. Yeah, making it a bit more equitable between researchers and patients. So yeah, so that's really what we were hoping to get out of that. So I think you all added some really great thoughts to some of the benefits about involving patients in the research experience. And as we go through this series of summer webinars, we'll explore a bit more some of the challenges and barriers that perhaps inhibit full and effective engagement. So if you haven't signed up yet, I definitely have to plug the remaining sessions. So please feel free to visit Charlbright's training website and sign up for any training sessions that would be of interest to you. So as we mentioned today, one of our main objectives is to go over the strategy for patient-oriented research. And so Canada's SPOR strategy really is a major initiative of our national research funder, that is the Canadian Institutes for Health Research. Ultimately, it is dedicated to the integration of research into care, and it's really ultimately about ensuring that the right patient receives the right intervention at the right time. So really, why are we here? Why in 2018? Why is this a strategy that is being considered? And so in the next few slides, we will broadly consider some of the challenges that face both the healthcare system as a whole and more specifically health research within Canada and really in North America. So a major challenge that the healthcare system faces is the fact that nearly half of patients don't receive treatment of proven effectiveness, and if they're not receiving ineffective care, up to a quarter of all patients would get care that is either not needed or harmful. Coming together, this care is also expensive, so a lot of resources are wasted on care that is not effective and not beneficial to patients. So a few years ago, in 2013, it was projected that the cost of healthcare within Canada would reach more than $200 billion a year. And really what these few thoughts really showcase is the fact that there is a strong need for turning the novel research findings that we are producing into high quality and cost-effective care. So this is a slide that many of you might be quite familiar with, and it might not be surprising to most that a recent review of existing literature on the topic showed that it can take an average of up to 17 years to turn only about 14 or 15% of original research findings to the benefit of patient care. So really what that means is it takes nearly 2 decades to translate research findings into policy change or effective changes to healthcare practices to the benefit of patients. And really, this slow pace is the result of a research model that takes research through various cycles of review and replication that ultimately would lead to the identification of best practice guidelines, which then are only partially or somewhat adopted within in healthcare practice settings. And really, with the figure that's being shown to you right now, it illustrates the challenge of knowledge translation that this strategy for patient-oriented research, or SPOR, is meant to address, and very aptly it is referred to as the 2 death valleys. If we move from bench science on the left, which then ultimately feeds into clinical science and knowledge, and then in turn into health decision-making and clinical practice, there are a myriad of challenges that create hurdles that must be overcome. And I guess anecdotally, there's a number of reasons for why we have these barriers in translating knowledge findings into effective care and to effective policy change. And one is that we have an overwhelming amount of new information every year that is published. Often this is contradictory in nature and doesn't really clearly delineate how these can be effectively incorporated into policy. And I guess secondarily to that is the fact that our healthcare system is a very complex and fragmented system that really is intractable to change and seeing things done a bit differently. So essentially the problem we have is twofold. We have these inadequate and inexpensive treatments, and we have a lot of novel research findings that just languish in published articles and aren't implemented into effective policy. And foundational to this SPOR initiative is the belief that this is because research is often far too removed from healthcare clinicians, policymakers, patients, and other key stakeholder groups. And really what that refers to is the fact that this knowledge is not really in the hands of the knowledge users that are really critical to bringing knowledge to action. And that's where this idea of patient-oriented research comes into effect as a way to address these problems and ultimately bring these key groups to the table to more effectively drive research agendas and ultimately aiding in the implementation of the work at the policy level and practically within the healthcare system. So I guess it's important for us at the start of the Samba Learning Series just to get a better idea of what patient-oriented research is. Traditionally, there's always been a lot of focus on physical outcomes that can be measured by lab results or stethoscopes or blood pressure cuffs. And these are typically the primary areas for concern when researchers test for any viability of a therapeutic treatment within the clinic. On the other hand, outcomes that take into account the needs, values, and even preferences of patients are called patient-centered outcomes. These would then ultimately take into account quality of life indicators such as fatigue or pain or emotional distress. And ultimately, these could be indicators that are sometimes more important to any given patient as compared to the physical outcomes that they are currently experiencing. Similarly, researchers have primarily directed the prioritization of research objectives in the studies that they conduct. But what patient-oriented research and Canada's strategy is trying to address is that patients, by virtue of their lived experience, can provide insights that oftentimes are overlooked by researchers. And really, this could be beneficial to the research agenda as a whole to incorporate in their study. So really a major defining feature of patient-oriented research within Canada is that it focuses on patient-identified priorities that are ultimately geared towards improving patient outcomes. Secondly, patient-oriented research is a continuum of research that engages patients as partners, with the ultimate objective of the SPOR initiative being to engage patients as partners throughout the life cycle of a research project. So from the start, when priorities are being decided upon, all the way through the conduct and ultimately to the dissemination of the projects. And really, what's important here is that these patients are engaged as partners throughout the work, where their involvement has an increasing impact on the overall decision-making process within the project and within the work. Now, ultimately, this is quite a strong deviation from how work has typically been done. So since it is such a big cultural change, this is something that may need to start slowly, where patients are first engaged in advisory roles, ultimately working towards that true partnership where patients would have equal decision-making authority with the researchers on the team. And just to plug our next session on July 26th, if you're interested in exploring this idea a bit further, we will be discussing the various degrees of patient engagement within and throughout the research process on our July 26th webinar. So if you haven't signed up yet and you're interested in learning more about that or engaging more on that topic, feel free to sign up and join us. Now, and then of course, a third defining feature of patient-oriented research is that it aims to apply our novel research findings into improving both clinical practice and health systems. So really, not only is the health research done in areas that are of more value to patients, but the work produces information for those key decision makers and healthcare providers that, when implemented, will ultimately be useful in improving healthcare practices, therapies, and ultimately policies. So to set up such a daunting initiative, there are a number of key guiding principles that are implemented to help drive this rather significant change. The first is support. Adequate support and flexibility is crucial and needed to adapt to patient participants and allow them, or give them the opportunity and the necessary ability to be involved in discussions and decisions. This support that we are I guess, discussing would imply safety, cultural competence, training, and necessary education. So really what it comes down to is enabling both groups, researchers and patients, through a variety of activities to come together at the same table and work and learn from and with each other. And I guess underscoring that level of support is this idea of mutual respect. And in setting up a supportive environment, there is a crucial need for an environment where researchers, healthcare providers, and patients come together, value each other's experience and experiential knowledge. Thirdly, a core principle of the SPOR initiative is this idea of co-building or working together, where partnerships between patients, researchers, and other key stakeholder groups would mean working together. And this ideally, again, is from the start of the spark of a research project, where you identify problems and gaps, set priorities for the research, but ultimately working together to implement the solutions or to implement the findings of the work. And lastly, a key principle again is this idea of inclusiveness, where since this is a rather novel way of addressing research problems, it's important to realize that engagement in this types of research would integrate a diversity of perspectives, particularly from the patient cohort, and that the research product or project that ultimately is designed is reflective of their contribution in setting up the priorities and designing the research study. So practically, what does patient engagement look like in this type of work? And again, this is something we'll explore in a bit more detail on the July 26th webinar. But really, what it comes down to is that patient engagement should be truly authentic and active, ultimately involving patients in various facets of the research project. Here we have governance, priority setting, conducting research, and knowledge translation listed. And practically, some examples of what that could look like at the governance level: patients can participate in the decision-making process of all activities within the network or the research project through their involvement in a variety of committees, whether that be active committees or oversight committees. Within the area of priority setting, which is perhaps what we are inherently more in tune with, is the idea that patient partners can help identify health research priorities and subsequently contribute in co-developing the research topics. So the patient perspective can be crucial in helping craft the grant, helping with the research ethics application, or even drafting up more effective patient recruitment strategies. In terms of conducting research, patient involvement can further be involved by informing the study design that is considered, helping define the outcome measures a bit more clearly so that they might be of more practical benefit to patients or research subjects that are involved. And I guess, as we mentioned in the previous point, is that patients can be crucial in helping co-develop a more effective outreach and recruitment strategy for patient subjects. And then lastly, the idea of knowledge translation, where patients really can be the most effective self-advocates. Not only can patient partners be involved with jointly presenting research findings and advocating for their ultimate uptake, they can be crucial in developing information and in helping develop patient-friendly or lay-friendly information about new treatments or new practices for new patients that would benefit from the outcome of that particular health research intervention. So since this is a national initiative by CIHR, achieving the goals of the strategy involves mobilizing relevant expertise and resources. And how this ultimately was set up was sort of twofold. One is funding a number of chronic disease SPOR networks where they focused on particular disease populations, and the other is within each province setting up a support unit, which is essentially a regional center that's designed to support those researchers that are engaged in patient-oriented research. And really, all they typically are locally accessible clusters of specialized research resources that are available to those who are engaging in patient-oriented research for support in more effectively and fully engaging patients in their research projects. So it seems like we're making stellar time. In terms of, I guess, tying that all back together again, CIHR strategy focuses on patient-identified priorities and ultimately aims to improve patient outcomes by ensuring that the knowledge generated is applied to improve the overall healthcare system and its practices. And really, it is thought that patient engagement within the research process will not only improve the relevance of research, but will improve its translation into policy and practice, and ultimately contribute to more effective health services. Because really, ultimately, the main goal of this whole exercise is to improve the quality of life of all Canadians, and ultimately result in a more strengthened and streamlined healthcare system. All right, so we will spend a few minutes introducing the idea of ChildBright. As we mentioned, this is a chronic disease SPOR network that's funded under CIHR's strategy. And as we mentioned, we're one of 5 chronic disease SPORs that are currently funded and active within Canada. Ultimately, ChildBright's work focuses on infants and children and youth with lifelong brain-based developmental disabilities, and consequently their families, since ultimately these conditions affect the unit as a whole. And this cohort of individuals includes children that have a diagnosis of a brain-based disorder. So we're talking about autism spectrum, attention deficit, cerebral palsy, fetal alcohol syndrome. So not only does it include individuals with that type of diagnosis of a brain-based disorder, but it also includes those that are at a high risk for developing these types of disabilities. So we're looking at preterm births or those infants that have a congenital heart defect. Our vision ultimately then is to achieve improved outcomes for children that do have developmental disabilities, but not only for them as well, but focusing on their families as well, and of course doing this across the life course. And so to achieve this, we have a triple aim framework in that our work is intended to improve child health and development, enhance patient and family experience, and ultimately design cost-effective strategies that are easy to implement and are of low barrier. The way that ChildBright is set up is that there are 4 major network-wide programs. The major output, of course, is our patient-oriented research arm, where our research program consists of 12 research projects that are conducted across Canada. Our 12 projects are divided into 3 main research themes, and each of them are intended to develop and test effective interventions that, one, for our first theme, Bright Beginnings, will improve the child's brain plasticity as well as developmental trajectory. Our second theme aims to improve child and family mental health and well-being. And our third theme aims to improve the patient and family experience within the Canadian healthcare system. Being that we are a national network, our 12 projects, consist of research teams that are distributed throughout the country, and they are all currently at various phases of development. And so yeah, if you need updates, please feel free to subscribe to our newsletter and connect with our research program if you are interested in learning a bit more. Following our research program, we also have a patient-oriented training arm of the network. And really, as briefly alluded to before, since this approach to research is quite a big shift in the way that it's typically done, we need to create that support. We need to create the resources to enable both patients and researchers to be imbued with the necessary skills and abilities to effectively accomplish these objectives. So ultimately, through facilitating a number of unique learning and training activities, the training program aims to increase capacity across all stakeholder groups within the area of patient-oriented research. Thirdly, our Citizen Engagement Council is crucial in providing input on all network-wide activities and initiatives to ensure that the patient perspective, including those of the families, are fully represented and fully representative of strategies and interventions or initiatives that are of more direct benefit to our patient population. Fourthly, our knowledge translation program is then integral in promoting knowledge to action and bridging those death valleys that we were briefly considering previously. And really, ultimately, they promote better ways to share credible information with relevant groups so that novel research findings can lead to effective policy change and ideally better treatment strategies and alternatives. All right, so now that we have covered the basic framework for the strategy for patient-oriented research and introduced you to Childbright, I was just hoping to open the floor to anyone to ask any questions. So feel free to tag in with your microphone, type it in the chat box, or if you wish, you can also follow up with email, and definitely get in touch with you. So if there are no questions, we will move on to the last few slides. And ultimately, it's a few announcements and housekeeping items. Next steps you might want to consider is to complete our post-webinar survey. So after this session, we will follow up with you via email and relay a short survey that you can fill out and sort of let us know how you found the session, as well as relaying some comments on the content and any thoughts that you may have on improving it. And just as a plug for our next session, the webinar we have scheduled is for July 5th. This one is titled Exploring the Barriers, Drivers, and Benefits of Public Participation in Research. Really, ultimately, what this session aims to cover is some of the factors that either promote or inhibit public participation within the research enterprise. Yeah, so please join us for that session if that is of interest to you. If you want to get in touch, feel free to check us out on our Childbright website or connect with me via email or phone at your convenience. And of course, just to end things off, I want to thank our funding partners who have been quite generous in supporting the work of Childbright. Lastly, I just wish to thank you all for attending today's session. I hope it has been useful to you, and I look forward to us connecting again at the other sessions. And of course, if you have any further queries, feel free to reach out to me via email or on the contact information on the previous slide. Thank you so much. Take care.